Good afternoon, or good morning, or good evening, depending where you are listening to us today. My name is Angela Asante-Armar, and I am stepping in for the lovely Dr. Unati Makiwe for today's Black Mental Health Matters show. Welcome, welcome, welcome. As you come and join the show, please take a moment to put and let us know where in the world you're joining from. It's always good to know where we are reaching. So today is what seems to be a continuation of a theme. We have been talking about depression last week, that moved on to suicidality. And this week, something that we picked up on the show last week was around stigma, the stigma around mental health. And so I'm really pleased to be joined by today's guests. We have Honorable David Naboare, from Director General of the Naboare International Institute for Mental Health Studies in Africa. And we also have a new guest today, the lovely Okailey, Psychotherapist and mental health advocate. So please give them a warm virtual welcome to the platform. Greetings, David. Greetings, Can you both hear me clearly?
Yeah, good afternoon.
Hi, hello everybody.
Good afternoon. Good.
Wonderful, wonderful. So I gave a very brief summary, really, to people to introduce you. But Na, can I just ask you to introduce yourself and give the audience just a little bit about your background, whatever you're comfortable sharing, please.
Okay. Hello everybody. Good morning, good afternoon, good evening again to you wherever you are. My name is Okailey. I am a psychotherapist here in Ghana. I currently consult at the Ghanese Municipal Hospital because I'm part of the COVID-19 case management team. So I deal with the psychosocial issues that are presented to victims who are infected or affected with COVID-19. I advocate issues. So I hope you got me.
Can you just repeat the last thing? I'm not sure if it was only me that couldn't hear you, but just remind the viewers. So you said you're part of the COVID-19. Is it like a
Yes,
case management team?
I was saying that I assist with psychosocial support for victims of infected victims of COVID-19 here in Ghana. And I advocate for mental health, mental wellness. I engage in programs that help people to cope better with their mental health issues or whatever emotional challenges that they are going through. And I live here in Ghana. I come from Ghana, so that's what I do.
Okay, thank you so much. You're welcome, Sister Na.
Thank you.
And Brother David, we know you've been on the platform before, but would you give the audience,
Yes.
in case we have first-time viewers today, just tell them a little bit about yourself, please.
Okay. Thank you very much for this very opportunity. This is Honorable David Naboare. I'm the Director General for Naboare International Institute for Mental Health Studies in Africa, a virtual platform I use to engage people on mental health issues. The CEO of the Naboare Foundation. I'm the National President of Community Mental Health Officers Association Ghana, a student at the University of Cape Coast, studying health science psychiatry. And also, I am a youth activist and the country director of Pan-Africanism Network. I am passionate about mental health and anything to do with mental health that some of us have been engaged in for the past 5 years. So we want to assure our listeners across the globe that they're going to have what some of them have not heard. They're going to enjoy the presentation from esteemed panelists like us who have great experience in terms of mental health, psychology, and stuff. Thank you very much.
Thank you very much, David. We're just welcoming more people onto the platform. So today, the topic is the stigma around mental health and how to go about seeking help if you have mental health issues. It's something that we touched upon briefly last week. I'm sure it has also been touched upon in previous shows because it tends to be something that's quite common. So my first general question to the panelists is, what is your interpretation, if you like, of this so-called stigma that there is around mental health, and how have you seen that present itself? Now, would you like to address the question first?
The question again, I didn't get everything.
Yes,
You're lying.
I was asking you how. What is your interpretation of this of stigma generally, and specifically as it affects or relates to mental health?
Okay. Well, when we talk about stigma generally is the negative attitudes that we have towards people or situations. So, narrowing it down to mental health, it is the negative attitude that we have towards mental health and then people who have mental health challenges. And here in Ghana, I cannot talk for the culture in other countries or other continents, but we realize that here in Africa or Ghana, there is a lot of stigma attached to mental health, first of all, because of the understanding we have about mental health. The only representation of mental health we have here in Ghana is that person walking by the street, naked, looking dirty, disoriented, and all of that. So it makes it very easy for people not to want to associate with such a situation. So immediately somebody presents any issue that is mentally related, then people automatically go into that default mode and then they want to do away with such a situation. It is not the best, but unfortunately, that's the context we have currently and we are dealing with. And I believe that with platforms like this and education going wide across the world, people will begin to appreciate the concept of mental health. That mental health is a key part of your fundamental health. Your
Sister Na, are you still there?
I think her network is quite interrupting.
I see. I wondered if it was only me that could not
Hello.
help her. Whilst she comes back to the platform, Brother David, do you want to chip in either to add to? Oh, she's back. Sorry, Now, do you want to
I don't
finish
know. I
up?
think I lost out. I don't know what happened to my internet.
Yeah, it happens. You were saying the last thing I heard, and I may have not heard everything, was when you were talking about that, our mental health is a fundamental part of our overall health.
Exactly. So your emotional health, your physical health, your spiritual health, and everything is what comes together to give you a total person, functional human being. So when an aspect of your existence is under compromise, it is because there's something wrong and you need to either reach out or understand whatever is happening so that you can get appropriate management or treatment for it. But if we only want to look at mental health with the eye of mental illness, then we are not doing justice to ourselves as human beings. Because even if you look at the definition of mental health, it's your ability to deal with the everyday stresses of life. It is your ability to add value to your community or your society. So if you are unable to find yourself within this domain, if you are unable to add a certain value or contribution to your community, if you are not dealing with the normal stresses of life properly, all these things are indicators to tell you that there's something going on emotionally or mentally with you and you need to reach out. You don't need to wait for it to get to the extreme point where it becomes a chronic illness and you need radical management to come in for you to become quote and unquote stable. So because we always wait for it to get to that extreme point, the only thing that we see, the representation we have with mental health is the extremities, which I just said earlier, that the people on the streets or people who are having extreme symptoms of mental illnesses. But it's unfortunate, and I believe that going forward, we'll do extensive education so that people need to understand and embrace the concept of mental health as part of your well-being, so that as much as you are taking care of your heart, as much as you are taking care of even your weight. People have fitness goals, but do we have goals for our mental health or our mental wellness? We don't. So these are the key areas of our mental health and in how stigma plays a key role in it.
Thank you so much, Sister Na. Brother David, would you like to add to what
Yeah.
Sister Na said, or obviously add your own interpretation and what you have seen?
Yes. Thank you very much, our host, and thank you very much, psychotherapist. Now, I'm most grateful, and because of my background and where I work, I always want to talk issues like this and present a practical view. Yes, stigma, as psychotherapist now said, it's a labeling that we give to situations and circumstances of which mental health and mental illness is no exception. Yes, I look at some determinants or some kind of situations and circumstances that we find ourselves in our mental health, that the stigma is quite evident. First of all, let's look at the client. The client, in a way, have been stigmatized. Number two, the family members of the client are also stigmatized. Number three, we the professionals, even my colleague will attest to the fact, some of us who work in the community, some they call us Abodam doctor. Just by labeling alone, it's kind of put some people off if they want to see you. Yes, then the facility, the unit, probably your mental health unit, you put the label there. People come in there just to seek some help. Because of that labeling, they themselves and the society try to put some labeling into that. And that way, it affects the way we render services to our people. I was just looking at some statistics, and if we want to state statistics in terms of stigma, almost anybody who have mental illness and a family who is having someone with mental illness in the community or the society is being stigmatized by the other family members or community members. And when you come to we the professionals, even we who are the mental health professionals, we are also being stigmatized by our colleague health workers. That is what at times some of us don't understand. So stigma, even as we know that the community members who are the ordinary people should not should be having issues with stigma. Even when you come to the health setting, someone who is in other professional practice with you tries to stigmatize you with the mental health practitioner. That is actually an issue that we need to talk about. So stigma today, as we are talking about, if I was looking at some statistics, they say 1 out of 25, but me where I work, it is not 1 out of 25. Almost everybody that I see, those who claim they are normal at this point, stigmatize that person that is having that mental challenge. Yes, so it is something that we must all look out for the solution for now, because I was listening to our psychotherapist talking about the way people try to put labels on situations and circumstances. People who are working out there are a lot of people who are in tie, but they are not okay. So whoever gets to know that this person is not quite okay, they try to put a label on the person, that this person, even me, who is taking care of them, if they can call me about them for doctor, how more or less my clients. So I don't know. We have to, as professionals and practitioners, through this medium, tell the general public that mental health and mental illness, of which some of us have been advocating for, and I actually like it that the Mental Health Authority, the Ministry of Health, Ghana Health Service, came out with this policy of deinstitutionalization of our mental health facilities. So if you have a mental health problem that is not so chronic, that will warrant admission, we are to handle you in your community. So why is it that our community is still stigmatizing us? Because they get to know that in as much as we take the person out to the facilities that will admit for a long period of time, the community tries to detach themselves from them. That detachment, that labeling that you have on there is what these departments and agencies were looking at to bring about the deinstitutionalization of mental health care, of which some of us, my professional association, we are over 700 in the country, and most of us find ourselves in chief's compound, in health centers. I work in a health center, and I'm even speaking right from my unit, that we are in the community and we see a lot of things. We see the issues real before we even refer. So I don't know, at times some of the issues we are able to handle, those we can't handle, we refer. So I want to say that clients are being stigmatized, family members of clients or caregivers are being stigmatized, we the professionals are being stigmatized, then the facilities and the units are being stigmatized. So where is our faith? Our faith lies in we trying to advocate and tell people that all of us out there, it is by the grace that we are saying that 1 out of every 4 in our lifetime will have mental illness. So will you know whether it is me or you out there in our lifetime that will have mental illness? And every family member, if you like, I'm just putting this in. I was looking into that if you study your family tree or history, there is someone in your family who has suffered mental illness before. Even if not, someone is likely to suffer mental illness in your family. So why are we doing this to our? So this is the time. I am saying that enough of the stigma. Let us all see how best we can support our family members now. Because when we come to these issues, someone I engaged in the other time on one of my platforms, I posted something on depression. He just called me that, David, I have 7 symptoms of what you posted. But if I was to go give a talk physical, I tell you, this person wouldn't have come out. So there are a lot of people who are out there with these problems, but they are thinking that immediately they seek help, they are labeled that Wapotam or this. But that is not the issue. They shouldn't let us give these names to our people, because the name we give them, put them off. We beg all of them. They should let us reduce the way we tag people who have mental problems. And I want to state here that for you to be mentally sound, it takes a while. And it takes somebody, or 28% of us, over a year to even tell family members that we have a mental problem. You could be suffering, but within you don't want to tell anybody. So do you know which that 28%? And 1 out of every 5 pregnant women will have mental illness. About 284 million people are living with depression. About 264 million people are living with anxiety disorder. About 21 million people are living with schizophrenia. Mention the bipolar and the likes. About 50 million people thereabout are living with epilepsy. So you can see that we are engulfed with mental and neurological problems in the society that we find ourselves. So why do we stigmatize? We'll come there when I come in my next bulletin to tell the society that these are where we have the challenges, from the clients, from the family, from the professionals, and from the facility. But where does this take place? It takes place right in the community and right with the community members. So we are the perpetrators of the stigma. Until we look for the sources, that this person is the one stigmatized. Look, someone stigmatized somebody the other time in where I practice. It didn't take much time. I was taking care of the family member. Before the person gets to understand what it takes to have someone who is having mental illness. Then I say, you see, I was just watching you because what I was doing at that time, I needed more attention to provide what I was supposed to provide at that time for this client. One is safe. It is not okay. Okay, let's go. Thank you.
Thank you, Brother David. There was a lot that you said there, and I want to move to some of the questions that we have. But what is obvious to me is that, you know, the idea of stigma is not a new one, and we have had things that we are dealing with and have dealt with for a long time that are still stigmatized. Menstruation, for one, for all women, it still carries a stigma. Yet every woman at some point in their life, they will menstruate. So I mentioned that for us to think about, should we, and if so, how much effort should we really put forward or focus on the stigma as opposed to just trying to address mental health issues as and when, you know, we actually get to see them? Does anyone have a view on that?
Yeah, you were saying that how much effort should we put into this? Yes, if we talk about effort, I think in our communities and societies, and in as much as we learn along, the basic definition we know about culture is that it is a way of life of people, and culture is sort of dynamic. So, since history, all these things we are talking about, menstruation, all that we are talking about, mental illness, since history, stigma has been attached to this. And it is high time we know that our culture should get to a point that there should be some dynamism, just because we need to solve some problems that we're facing currently. Until then, we'll continue to go through some of these things. But at times, it baffles some of us, our imagination, that some people that are even learning are involved in some of these stigma circumstances. So I don't know. So our culture should be looked at. Next thing we have to also look at is that we should provide the platforms and be able to talk about various forms of stigma, be able to talk about instances and places that people get stigmatized. We should be able to talk about some kind of issues and things that we are faced almost every moment. If I say daily, it means it is today and tomorrow you face it every moment. Because it's like every moment we are challenged to that stigma. One thing you are saying that is that the menstruation and the likes. And so most cultures, some of us in my culture, they still have issues with those things, because they tell you that if you want to be a man, you need not to associate yourself with a woman that is menstruating. And much research has not been done. But who am I, who is just maybe less than 30 years, to challenge my elder brother who is 70, 80? That is about we trying to look for what is normal and what is abnormal. Looking at our cultural perspective in moving forward, because the way our great-grandparents lived in the 1600 or 600, 1600, in the 1900s, it's not how we live now. Therefore, issues and things must revolve for us to be able to accommodate some of the things. So, how much effort we need is about the individual's perception about some of these things. It is just at times about our perception. Okay. Let's work on our perception. Let's look at places where we get this stigma coming from. Let's look at how best we can use various mediums to be able to counter and provide solutions to some of these forms of stigma. And let's look out for advocates of stigma. Therefore, we'll be looking at how best we are arresting some of these things in our generation and younger ones upcoming. We provide this from our generational lifespan. the elderly will be given this form of education, we the youth will be given, those adolescents will be given. Thereby, when they are progressing to the adulthood, they will carry this information along. Thereby, we'll be able to gather much efforts, much energies, and much solutions. And also, we should write on some of these things and publish. Look at our cultures and write some of these things and publish. Not trying to prove the negativity, looking at the health-wise, looking at what disadvantage it is doing, and probably some minute advantage that will not just take everything off our society. Thereby, people begin to understand us. So I think this is just some of the efforts I think we can put into some of this stigma. Yes.
Okay.
Can I come in?
Absolutely, Sister Now, go ahead.
Okay. My point will also be that I think it's high time we begin to mainstream every aspect of our well-being, whether mental health, physical health, because before now, our policymakers thought that putting mental health under a different umbrella was going to make it easier for people to access mental health services. But going forward, we have realized that it is rather increased the labeling and then the stigmatization that is going on, because it hasn't done anything to the existing stereotypes people have about mental health. So if you come to our facility and you see mental health center, or you are told that, oh, we are taking you to a psychiatric hospital, people will question, why are you taking me to a psychiatric hospital? Why can't I access my services or the services I need right at the mainstream hospital? Government has coined a name, universal and primary health care. But under universal and primary health care, mental health care is not captured there. So you realize that even national health insurance covers universal and primary health care. But because mental health is not clearly stated there, you still pay for mental health services. So you realize that even in our policies, even in our dialogues and our trying to mainstream society, we are still clearly stating out stigma. We are still discriminating against mental health challenges or people that come with mental health problems. You can I dare say that every physical health condition has mental health implications. So imagine if you are diagnosed with cancer or whatever illness of a sort, and we get a lot of referrals coming in from medical and internal medicine and all of that. So let's say you have someone who is suffering from hypertension, and because of some issues going on around them, their blood pressure is constantly not being managed properly. So you are being referred to come and see a therapist. But during your BP clinic, it is free. But you come to the psychologist and you are being charged to pay. So now there's a lot of disparity when it comes to that place. So even at the health level, at the primary health level, yes, healthcare is now becoming very accessible. But when it comes to mental health, we are still putting barriers. We are still putting up standards that is making it difficult for people to do away with the stereotype. So if I tell someone that, oh, you can walk into Kolebu, you can walk into 37 and speak to, a psychologist or even a psychiatrist, some of the hospitals have been able to mainstream it. Even though you are paying for the services, you are consulting just like the normal, everybody consults at the hospital. So it makes it more easier and comfortable for them to access the service. But if I need to move you to some extreme part of the clinic, automatically people will know that anybody going towards this side is having a problem with regards to mental health. But if you are able to mainstream these things, that even under our regulations, our policies, mental health is categorized as a mainstream health concern. Because the truth is, your brain is the one regulating everything that has to do with your body and your existence. All your organs are some way, somehow related to your brain. So how come the brain is being marginalized this much, but the other parts that are being regulated by the brain are given so much priority? So I think we need to, as a people, begin to mainstream some of these conversations and make it normal that it is okay for you to have these conversations. It is okay for you to admit that you are not fine. It is okay for you to come out and then say that this is how I feel, this is how I think. These are things that I've been, experiencing lately one way or the other. And by, as we normalize these conversations and to break the existing stereotypes people have, my brother was talking about culture. Unfortunately, Ghana is like our culture is so dear to us, we find it difficult to let go. But the moment we understand that the culture we are holding on to is doing so much damage to us, that is the beginning of our freedom. Because 20 years from today, research is showing that depression is going to become one of the top issues that people will be dying from. So if we don't start dealing with it now, and I think COVID-19 has even exposed us and the lapses we have with regards to our mental health, the anxiety, the panic that everybody was going through has given us a taste of what it feels like to be mentally unstable. And I think this is the time for us to start prioritizing some of these things, especially at the policy level, so that everybody begins to understand that if you start picking these signs in your children, in yourself, in your partner, in your friends, it is okay for you to walk to them to any facility and access healthcare. You don't need to, isolate the services that we have under our healthcare to make it easier for people to access. Because the truth is, it is rather increasing the stigma that is going on currently. Maybe I'm talking from a practitioner's point of view, but if you speak to patients that come to the hospital, they will give you their discomfort with coming to see a therapist in a labeled facility, that I need to come to Pantine, I need to come to Accra Psych. Why do I need to come there? The moment you mention Accra Psychiatric Hospital, people will, even if they are not fine, they'll pretend to be fine because of the existing stereotype that has to do with psychiatric or psychological problems. So I think going forward, we need to also mainstream our health system so that whether mental health, whether cancer, whether kidney issues, all of these things are easily accessible as a mainstream facility or a mainstream service that anybody at all can access.
Thank you so much. Wow. Uh, you both said so much. The things that I definitely want to pick up. So yes, we definitely need, I would like to say positively, I am seeing an increase in the number of platforms that are available to discuss these things. But it's true. It's almost like when you provide such a
Angela, I
focus
think
on
your line is
something.
breaking. I
Oh, I'll speak slowly. What I want to say is, whenever you are focusing on something, it's almost like you are pointing out how different it is. So this is coming back to what you were saying about the labeling. I'm speaking slowly now because I know the connection is not good. um, so that's an important thing. Absolutely, we are holistic, like we are a whole person. Yet I would say I think we have inherited a way of approaching our health, full stop, in such a compartmentalized, divided way. So usually the thinking is that you go to a GP, a general practitioner, because they know something about everything. And then the attention or and even the money, the serious money goes to specialists. But you need to start from the general, because one part affects another part. So especially what you were saying, that our mental affects our physical. Everything affects something else. Our spiritual, mental, physical, emotional. And last week I mentioned how one example of the late Steve Jobs, the founder of Apple, that eventually, he died. I think he had two episodes or two rounds of with cancer, two battles with cancer, pancreatic cancer. And when you look at what emotion is associated with the pancreas, it is resentment, like coming from anger, resentment. And he was known to be a really angry and resentful person. So there are things that if we don't deal with mentally or emotionally, and even spiritually, our body will manifest that physically, and we then really know there's something wrong. So I think it's so important what you said, that how we just address health. You know, of course, there are different parts of health, but not make one look like it's more serious or less important than the other one. That makes such sense. I want to now take a question from our live audience, because it's been there for a while. So the question is, what are the key habits where individuals can pick up early on the disintegration of mental health? You know, how do we, the layperson, what can we identify, and that will make us think, okay, this person maybe is not doing too well mentally? David, do you want to take that first?
Yeah.
Hello?
I think you were asking where
Okay.
you can pick up to see that there's actually something happening to someone's mental health. Is that what you wanted to know?
Yes, sorry, I don't know if you can see the question that is on the screen. It should say, what
Okay,
are
what
the
is
key
it?
habits
Where
where
individuals
individuals
can there's a disintegration
exactly?
of mental health. Actually, this question meant where we can actually find out that there is actually a problem with somebody. Yes. So, from the point of practice, I will always commend community members and family members that the normality and the abnormality of every member of the community is prescribed by that community and its members. So to be able to even tell us, let's say the overseas, for them to come to us that they are suspecting something, they should be able to establish that this thing is actually getting out of the normal and is now in the abnormal. Therefore, they think there is something happening to him due to their social norms or their societal norms. So let's say in their society or community, this person used to eat with the entire family members. That is how some of them grew up. But now he's now isolated. They don't see how he interacts with them. He doesn't give out. He doesn't bath. These are some of the things they will see in those people. And also, going to see significant deterioration in the person's general health. Some of the cases, what the family members will always come and say is that the person begins to talk anyhow. The person doesn't eat. The person says, I hear voices. I see people where there are no people. I feel like I am being poisoned. These are the cardinal signs that you see in them for you to establish that there is disintegration in this person's mental health. So the person wanted to know, the key things is that there will be, for our artists, there will be hallucinations, delusions, and stuff. And the person will begin to tell you that, some can even tell you that I am the president of the Republic of Ghana. Or I feel like the entire community, I am the chief. Why is he the chief? These are some of the things you must know that is speaking from a normal point of view. Therefore, there is a problem. The family members know feeding habits. They should know your social habits. They should also resort to substance use and stuff. Now they drink more, they neglect responsibility as well. So these are the things you will see. It's to reiterate the topic that we're discussing. Mental illness and stigma are inseparable phenomena that we cannot do away with. Since history, they are with that. So, in as much as the disintegration of your mental health due to these cardinal signs and symptoms that are evident, you should be able to know when your family member has this challenge or not. And wives, especially wives, you'll be the first people to know that my husband used to give us spending money. Now he's not trying to give. What is actually the problem? You should be able to know my husband used to bath 2 times a day. Now he baths once a week. You should be able to know my husband used to talk to me almost every time, but now it takes a month, even placing a phone call. My husband used to groom himself, but now there's actually a deviation from the normality. So whenever there is a deviation from normality, the abnormality, you should be able to establish that there is deviation in one's mental health. Therefore, the person is getting that illness, and something should be done to support that person. And that should be done due to key habits of that person, what the person does over a period. Because if me, David, you have not stayed with me now, probably I used to be someone who is outgoing. Maybe you see me and you might think I am those kind of people having a million types of conditions, but maybe that is how I live. I am those very cool types. So you should be able to establish due to how I'm able to cope, so that you'll be able to know. But the family members will be able to know whether there is disintegration in your health or not. Therefore, they should be taken through some education to know what is normal and what is abnormal. Yeah.
Thank you, David. Now, would you like to would you like to pick up on this question and also mention the ebook that you have about self-care, which I imagine is an important part